Hi, I'm Dr. Greg Mendel, your friendly anatomy professor. We're going to go over the bone model. Come on in, let's take a look. When you look at the bone model, the first thing I notice is that this kind of looks like a piece of pie, and this would have been a complete circle, but we just took a slice out, if that makes any sense. This would be the inside, this is the outside. So on the outside we have the periosteum, dense regular connective tissue covering that would go around the whole bone. On the inside we would have the endosteum. So the rest is compact bone, except there might be a little bit of spongy bone on the very inside. But when you look at the compact bone, let's talk about overall how this is built. First of all, the periosteum is secured to the compact bone by these fibers. You could either call it perforating fibers or Sharpie's fibers. So this is on pretty darn strong. We see that a blood vessel first came into the bone, and you can see that this is going at a 90-degree angle, or at least somewhat of an angle. It comes in sideways. You could either call this the perforating or the Volkmann's canal. And then we see blood vessels running up and down within the central canals, and they're also called the Haversian canals because this is called another name for this is a Haversian system. So what happens is we have blood coming in, osteoblasts will go around that blood supply. They secrete their osteoid, which is basically like the consistency of toothpaste, goo, and it hardens with hydroxyapatates, mostly consisting of calcium salts. And over a period of 3 to 5 days, it hardens, and then we have this circular thing called a lamella. And then we do the same thing, except second, third, fourth, fifth, and so on, rows of this, or circles. Once the osteoblast cements itself into a little hole, it changes name to an osteocyte. So an osteoblast builds, an osteocyte maintains this bone. When you look at it under a microscope, you're going to see kind of like there's little holes here and here and here and here. And so these holes are again called the lacuna. And the lacuna are the spaces for the osteocyte, whereas the rings are lamella. The one thing I noticed is on a test, some people have a rough time wondering, is this lacuna or lamella? And they need kind of a hint. And I say, if you look at this from the side, these osteocytes kind of look like little bugs or ticks, or let's just say cooties. So the little lacuti goes in the lacuna. It rhymes. If you say lacuti and the lamella, doesn't rhyme. So it's just something to trigger your memory there. So what we see again is the central canal, a bunch of rings of concentric lamella, making this thing called an osteon. The osteon is the circles. So you can kind of see that this osteon is newer than this osteon because it kind of cuts into it. So what we have is old and new osteons, and they form these circles. But remember that if you have a bunch of circles, there's got to be a space in the middle, and that's what we're seeing here. So these rings of lamella are concentric. They're all in a row, but we've got leftovers here. And so the ones that are no longer noticeable around osteons, that's another type of lamella we're going to call interstitial lamella because it's between the other osteons. Now a third type of lamella we see on the outside. It's on the outside and it goes all the way around the bone and it circumducts the bone. And so this is called circumferential lamella. It goes all the way around and around the outside, circumferential. So we have 3 different types of lamella there again. Here we see an osteon coming up out of this bone. Now what you see here is, first of all, you can see these little grooves or laying down of this collagen fibers before it hardened, and they go different directions. This is like, say, counterclockwise, clockwise, counterclockwise, clockwise, left, right, left, right. And the reason they go back and forth different directions is so to prevent twisting forces. So it becomes a twister resistor. The other thing I wanted to mention here is that there's little bitty cracks in the lamella. Now the reason for that is if the food source is here and all the osteocytes are kind of stuck, they need nutrition from the food source. So the way they do it is to go little extensions of the osteocytes are traveling and pushing food back to the far away ones and then bringing cellular waste back. So these little cracks are called canuliculi. Now I remember that as sounding like, can I lick your eye? Which would be weird, of course, but there's also these near the another similar term by the eye. So I just went with the term, can you lick your eye? Can I lick your eye? And so it just helps jar your memory of what those are called. And I believe that is it.